I've had an injury in my shoulder for many years. It just would ache all the time. So I would always complain to Matt that it was hurting, and he got sick of me complaining.
But it wasn't just affecting her with pain, really her quality of life. I really had a huge interest in stem cells and started exploring options there.
So finally, he convinced me, and we did some stem cells on my shoulder, and I haven't complained. So that was the real thing, is Matt hasn't heard me complain.
1 year without complaining, that's pretty darn good in
Yeah.
my book.
Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in.
Hey guys, welcome back to Look Good and Feel Good with Matt and Amy. In today's episode, we're going to talk about a controversial topic, stem cells, and how it's affected lives of those that we've been around. And we're going to go into Amy's little stem cell journey with her shoulder.
So I've had an injury in my shoulder for many years. Gosh, probably about 3 or 4 years. It just would ache all the time. What is it called?
It's called impingement syndrome,
Okay.
where
Impingement syndrome.
the shoulder gets pinched under a bone on top of it, the rotator cuff, and it causes chronic pain and lack of mobility and
it would hurt, and it's not fun. And I don't like pain. So I would always complain to Matt that it was hurting, and he got sick of me complaining because I'd be like, I can't sleep. It just hurts. I go grab stuff and I couldn't lift, and it just constantly, chronically just hurt. And so when he was working in the orthopedic practice, he would just do Kenalog injections. Actually, we'd be at our house, and he'd just be like, okay, we'd be watching TV, and he's like, let me inject it. And I'm like, oh.
Believe me, it took her a lot to have an injection. She absolutely.
Well, I do injections all day, but I don't, the needle's like this big, and it's like, anyway, he would stick it in there, and I'd be like, dude, if you do it slower, it wouldn't hurt as much. And then he'd be like, don't critique me on my injection technique. And I'm like,
oh yeah, she would be like I've done thousands of these, and she'd be like, Matt, don't do it that way. You need
I'm always feeling like you can always
slow.
have a good critique on how to do injections. Anyway, so we would always do these Kenalog injections, and it would feel better for about 2 to 3 months. I'd get relief. After the first day of doing them, there'd be so much cortisone, and I'd be like shaking, like, oh, but I couldn't sleep for a couple of days, but it would help. And so we got into this field, and Matt was like, dude, we should try stem cells on your shoulder. And I was like, yeah, it probably won't work for me. That's kind of what I thought. And so finally, he convinced me, and we did some stem cells on my shoulder. And it hurt for a few days afterwards. Like, I was like, I don't think this is getting better, Matt. I'm still feeling a little achy. But it's been a year now, and I haven't complained. So that was the real thing, is Matt hasn't heard me complain.
1 year without complaining, that's pretty darn good in
Yeah.
my book. But it wasn't just affecting her with pain, really her quality of life. It was hard for her to sleep. She loves to work out. Any like overhead activities, it was really bothering
Well, and plus
her.
it made me grouchy.
Yeah, I can testify to that. Definitely did. So every time she'd start complaining, I'd say, well, this is, mind you, 3 or 4 years ago, I'd say, well, you've done anti-inflammatories, you've done therapy, you've done everything, and it still hurts. So let's try a cortisone shot. And reluctantly, finally, she would, and it helped, but it was more like a Band-Aid.
Yeah.
She said it helped for a few months, and then the pain would be back. So what are we doing with cortisone? We're putting a temporary fix on a bigger problem that with cortisone, it will actually break down tissue instead of healing tissue. It's great for pain and inflammation, but it's not good on your tissue. So about 3 years ago, I really had a huge interest in stem cells and started exploring options there. So let's deep dive a little bit into what stem cells are and where they come from and how we can use them. You can get them from a few different locations. You can get them from your own body. You can get them from bone marrow. It's a procedure I've seen done several times. I've not done those because afterwards, I think seeing what happens, the hips are basically bored out with big syringes, and they attempt to suck out stem cells. It's very painful. I think I'd rather have a hip replacement. Another way to get stem cells is through fat, adipose tissue. So it's almost like liposuction, and and then they're broken down and injected back into the body.
And also blood, right?
Yeah,
A PRP.
PRP. PRP is different. It can come from blood. PRP is where your blood is drawn, spun down, and then platelet-rich plasma is extracted out and injected back into an injury site. So those are all decent methods. However, what I have seen be way more effective are umbilical cord stem cells. So umbilical cord stem cells are taken from live birth. Again, live birth C-sections, no abortions, no funny stuff going on here. They're taken and tested extensively, actually 3 times before they become FDA registered. So these stem cells are very potent. Stem cells are the building blocks of everything that we have. And these types of stem cells can differentiate into certain tissues. So as I started to mention earlier, you can get an anti-inflammatory healing property. You can get a better quality of life. But the biggest difference in stem cells is they can actually rejuvenate or regenerate tissue. So it's a healing process, not just a get better and feel good process.
Well, and the thing is, I think, you hear this and you almost feel like it's like, is this really going to work? It's not like this magic or witchcraft type stuff. And I think as medical professionals or surgeons, they do surgery. That's what they do. That's what they go fix things. They don't understand maybe, or don't believe that stem cells can maybe happen. But a lot of information, new information is coming out about it.
Oh,
and
yeah.
a lot of people are searching for it. And it's kind of funny because you used to think you had to go to Mexico or Panama or, out of the country, the United States, to actually get these products. And they are here in the United States. We have them here in Idaho, of all places. And Matt's background of 20 plus years doing orthopedics and injecting, he has seen bone on bone arthritis, and he didn't think it would get better with stem cells, but he's treated some of these patients and they've actually improved. I mean, he's maybe had a few go on to have to go do joint replacements, but most patients have gotten some relief, especially some people that are not candidates for surgical repairs. So,
well, and to kind of, I would really augment what you said by saying, holy smokes, everyone has gotten relief. It just depends on the amount. Sometimes it's miraculous. Like, I've had several people even signed up for total joint surgery that have canceled because they've done so well. And this is like 2 years later now, they're still doing great. So it can help repair arthritic change, cartilage. It's great for soft tissue as well, like rotator cuffs, like Amy's, tendons, elbows, ankles. Gosh, at this point, we've done injections in necks, backs, hips, SI joints, work your way down the body, shoulders, knees, ankles, Achilles tendons, plantar fasciitis. And it's been amazing. I had to be convinced. I wasn't convinced at first because I came from the world of just fixing everything in orthopedic surgery. It's what I did for 23 years of my career. And usually it works pretty good, but sometimes the outcomes, even with a perfect surgery, and I worked with phenomenal surgeons, even with a perfect surgery, sometimes the outcomes were not favorable. They weren't great. And after that, there's really no going backwards. There's nothing else you can do.
And the procedure itself was actually a very simple procedure. It's just like a cortisone injection itself. It wasn't really any different. And after, the injection.
Actually, much less painful than a cortisone.
Well, it's funny. It's still a shot. It's still an injection. So it's a needle going into here. But after the injection, that's where I noticed the gradual improvement over the next couple of weeks. And I could move it better. The pain was gone. It wasn't there as much. I was able to do things without pain any longer. And, here we are like a year later, and I haven't had any more cortisone injections. I haven't had any stem cell injections either because it felt better. And so I truly believe stem cells, gave me my shoulder and my life back. And anyway,
yeah,
I'm appreciative of it.
Well, I have arthritis in one shoulder. It's called post-traumatic arthritis. It was an injury from football where I dislocated my shoulder and went on to arthritis at an early age. So I've suffered for the past 30 years with left shoulder pain and right shoulder pain in the rotator cuff. So the same day Amy had her treatment, I actually had mine treated by a local PA that I asked if he'd come over and inject my shoulder because I trust him. He's awesome.
Because he doesn't entrust me to inject his shoulder. I don't do shoulders.
She doesn't do that. So, but he did. And now it's a year later. I've never had better relief with either of my shoulders. They're doing amazing. Another example that I think is important to look at, we had a patient in her late 70s, early 80s, and she came in with bone-on-bone arthritis and said, hey, I'm ready to sign up for total joint surgery, but I want to try this first. And I looked at her x-rays, bone on bone. I said, well, yeah, let's give this a shot. No pun intended there. But now she is well over 2 years out. And I just saw her last week, still doing amazing, walks every day, hasn't even thought about surgery since then. So some of the results are downright miraculous, but everyone that because I like to get a percentage, everyone we've treated has had at least 40% relief, minus maybe 1 or 2. So those are pretty darn good outcomes. And it can be done in young people, old people, anywhere in between.
So anyway, it's just one of those things. It's just if you're dealing with a chronic pain or looking for other options, stem cells can be an option. And like we said, there's different ways of stem cells. There's stem cells there's a lot of new things coming out with stem cells for like autoimmune type diseases and, doing it through IV. And we there's different ways to treat these things with these new products that are coming out.
Yeah, there's some amazing products, but the key is to know this is also safe.
Yeah.
These are registered, they're tested. I will not use anything that's not tested and registered through the FDA. It's still considered quote unquote experimental, and that should be clear. So insurance will not pay for stem cells or PRP for that matter.
So it might be something to work, start exploring. It's not just about masking your symptoms. It's about addressing the root cause and, helping your body heal itself.
Yeah.
So,
and every case is different. And what I will only comment on is what I have seen. So be careful on the internet. You might find studies for or against stem cells. I can only comment on what I have personally done. And it's been awesome. It's been really amazing, the results.
Well, and you have to say, how long have you worked in orthopedics or in this field? How many years?
Oh, well, 25 years.
25
in
years.
This field now. So
you've seen a lot. You've seen a lot of different.
I've seen some incredible stuff and some not so incredible stuff through the years. I've also seen the pendulum swing from one end to the other on different treatments. But stem cells are here to stay, and they're only going to get
better.
But
just knowing you can stay in the States to get things done. Like there's a lot of clinics out there in the United States that actually offer these treatments. Just kind of do your research, kind of see what they use. But it's not like we're harvesting them we don't harvest from your own body. We don't do any of the bone marrow or fat cells. And
I'm not saying that's a bad way to do it. I just don't think it's the best way.
Well, and because you say if you're taking it from a 50-year-old body, you're going to have 50-year-old stem cells. Whereas if you use unmanipulated stem cells from the young, and that's what you have.
Those stem cells are vital. They're ready to go. And the cool thing is, I think this may have been mentioned, but they can find the area. Like let's say we inject a shoulder with rotator cuff issues. Those stem cells know where to go. They know where to attack the inflammation. And fortunately, I've been doing injections for 25 years, so I'm very confident I can get them where they need to be.
Yeah.
So,
well, thank you for having us today and listening. And we'll hopefully have these done every month. And if you have topics you would like to have us look into or discuss, please let us know at our website.
Thank you.
Thanks.